Here we are at part 2, skull bones. Okay, so this gives you an idea of where we are now. We're at page 203, and I'm again looking at this frontal view of the skull. And one of the questions I'm going to be asking you on the quiz coming up is, if I were to put a mid-sagittal line through the skull, pass a mid-sagittal plane through, which bone would not be touched? Now, of course, if we have a singular bone that goes through the midline right here, the mid-sagittal, that's going to be touched. And we're going to be touching down through the suture of these two bones. And we're going to hit that bone. We're going to go through the suture of this one and this one. But notice, over here we have this little green bone called lacrimal. That's not touched, is it? And then we, over here, have this bone that's called Zygomatic Bone. And again, that's out of the way. And so it's actually not touched. Okay, one of the things that we're going to be learning about when we study the ethmoid is that it's got these little special processes here called concha. There's a superior, a middle, and an inferior. The inferior, though, is its own bone, and it's paired. Okay, so the inferior nasal concha is its own individual bone, and it's paired. Another detail here that's hard to make out from this view, but you suspect that it's true, is this bone over here and over here, which is the temporal bone. Actually, that's a paired bone, and it too is far away from the midline. It does not cross the midline. It's a paired bone, thus not touched by a mid-sagittal plane. Okay, so I can ask you which of the following bones are singular and not paired, and you would have learned them already. And then which bones are paired, not singular, you would have learned those. And then which bone is not touched by a mid-sagittal plane going through the skull. And then you would have learned those paired bones that are away from the midline. Okay, so let's continue on with this view, except I'm going to digress here just for a moment, and I'm going to bring this to your attention, that we have a parietal bone and we have a frontal bone, and we have a classic suture right there and right here. And that's actually referred to as the coronal suture. And we have another view of it that's coming up. Right now, though, we have a suture right here that's formed by the two parietal bones. It's called the sagittal suture. And then over here, we have a suture that comes this way, sort of forms an L, and so that's referred to as the lambdoidal suture because of the shape of the suture itself. It's between the occipital bone and the two parietal bones. Okay. And then here, between the frontal and the parietal bones, is this suture, the coronal suture. So that fills out the three sutures that I'm asking you to learn. If you'd like to also learn squamosal, that's excellent. Okay, so and we have our arch here. Okay, between the temporal and the zygomatic bone. Notice how we have the sphenoid that comes all the way out to the side here, a little portion of it. Okay, so those are things to consider and take into consideration. Here we have this view. Notice that we have a view here that provides us with openings in the bones. Do you see that? We have these sinuses. We have a frontal sinus. We have this little unit right here is the sella turcica, and it's part of the sphenoid bone, and we have a sphenoid sinus. So you have to ask yourself, why do the bones have sinuses? And it turns out that that's what we do to lighten up the bones so that we can not have such a heavy head, as it were, and keep it up there poised on our neck. And again, I'm bringing you this little detail here of the palate. We've removed the mandible in this case, so we don't see that anymore. And now we can get a good look at the palate, and it has 4 bones. Okay, and then here's that separation between the two sides of the nasal cavity. Here's the central view here of the sphenoid bone touching all of these other bones, as you can see. Okay, this big opening here is called foramen magnum, and it has the spinal cord reaching up into the beginning of the medulla of the brain. Okay, the brain stem. And again, we're going to be looking at this. We have an anterior fossa, we have a middle fossa, we have a posterior fossa, and we're going to be looking for specific openings in those when we get to it. This is called the Turkish saddle, or the sella turcica. And the significance of that is that the pituitary gland is seated right here. Just above it is the hypothalamus. And we have a reservoir of blood. It's also surrounding these endocrine organs. So we're able to deliver hormones directly to the blood right there. And then as we come through the pictures further, here's what it looks like to see an individual temporal bone. Here's the arch. Here's the opening for your ear, the external acoustic meatus. Here is something called the styloid process. Right here, between the mastoid and the styloid, is an opening for the facial nerve to come through. Okay, here is the sphenoid bone, and you'll notice that it has certain features. It has these downward features here called pterygoid processes. It has wings to it. It has a lesser wing and then a greater wing. And as you recall, the greater wing actually created a feature on the side of the skull, right near the temporal bone. Okay, so looks a little bit like a butterfly, or maybe even a B-1 bomber or something like that. Here we have a very centrally located bone in the skull. It's called the ethmoid. We have a perpendicular plate that separates the two sides of the nasal cavity. Oftentimes with natural vaginal childbirth, things can get a little twisted here, and some people have, compromised openings on one side or the other, a deviated septum, in other words. Here we have also, these are air cells. They're filled with air. They're like a sponge. Okay, and again, we're lightening up the skull here a little bit with that. Okay, then coming over this way, we have our mandible. This is the part that articulates. This is the part that's grabbed by a muscle, and it's pulled upward. They're showing us that we have teeth that actually penetrate down through the bony structure here. Okay, here's the maxilla, and the teeth here are positioned in the maxilla for the upper jaw. Over here we've named 7 bones that you need to know that make up the orbit of the eye. So here we are at the lateral side, and we have the zygomatic, we have the frontal bone, and we have this part right here called maxilla, and the bone right here is the lacrimal. Deep inside we have the sphenoid bone. Okay, we have a little bit here of the ethmoid sneaking in. Okay, and just barely visible, look at that, there's just a tiny little fingertip right there of the palatine bone. Okay, so altogether, if you come to this page, which is page 213, you'll find 7 bones right there. Okay, here they're going to get into what is the nasal septum, made up of 3 parts actually. It's got the ethmoid above, perpendicular plate, the vomer below, and we have cartilage here. Okay, so 1, 2, 3 parts of the septum of the sinus, and it's sitting on top of the hard palate. This lady is demonstrating her sinuses, the sphenoid, the frontal, and deep in here are going to be other sinuses that are named for us. You can check that out. They're not just for the purpose of giving you a sinus headache. They're for the purpose of lightening up the skull. So those are all the skull bones, and then we'll get greater detail.